All right, good evening, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. And tonight I'm talking about POTS, probably one last time this week. As many of you know, I've done several videos on POTS, also with, hi everyone, also with Kathy. We did kind of a review this weekend. Everybody seemed to like my artwork, which is always comical, in trying to draw out some of the pathways for blood sugar regulation, or excuse me, blood pressure regulation. It is after 11, so hang with me. And so with that, one last piece I want to talk about as it comes in the arena of POTS is anxiety and this disorder. So POTS, for those of you who don't know, stands for postural orthostatic tachycardia syndrome, i.e. you stand up, your heart rate starts going really fast, and you tend to feel dizzy, or you feel lightheaded, or you have brain fog, or you have like muscle pains. You may have GI symptoms, things of that nature. So there are a lot of overlapping symptoms within the POTS syndrome, which POTS, the last S stands for syndrome. So with that, I think it's important to note that, and I've tried to make this clear in the other videos, that POTS is real, and POTS causes a lot of you to not feel well, and frequently you're misdiagnosed, leading many of you to think that you're crazy and that, you know, family members just don't understand what's wrong with you. You're going to see doctors, doctors don't get it, doctors aren't diagnosing you. Maybe these are the stories I hear. By the same token, we also have to understand that with POTS, that the abnormal sensations from your body with not getting enough blood flow to your heart and up to your brain, and the resultant fast heart rate, that this creates weird signals in your body that go into your brainstem and go into your brain. And new research is actually showing that the POTS is anxiety producing. Maybe that's not a shocker for you, but it's important that we talk about this, because if the sensations from your body alone in themselves are enough to cause you to feel anxious, that's a big deal. And it is discussed in the literature that POTS causes quote unquote behavioral amplification. And the researchers are not saying that you're acting crazy, it's just that you have so many weird sensations in your body that's causing you to feel anxious, and then it makes you nervous about getting up, moving around, doing things, exercising, which kind of overlaps with something I've talked about, in that it's fear avoidance. This is all throughout the low back literature. Somebody hurts their back and then they go in to lift weights again, or they go to, you know, mow the lawn, and they're really afraid because they're afraid that their back is going to go out. So that's called fear avoidance. And it's really the same thing that we see with POTS patients. So something to be attentive to, what your family needs to know, your friends need to know, even your doctors need to know, is that POTS is totally real. It's mainly, well, I can't say it's mainly, but a significant percentage of POTS patients have autoimmunity. Estimates vary from research article to research article, maybe as high as 46%. That's what I've seen. And some of you with POTS have neuropathy, where your immune system may be attacking the nerves that coordinate blood pressure. All of that's really real. And even the adrenaline that goes up, as I've talked about in the other broadcasts, the high adrenaline with POTS by itself can cause anxiety. Hyperadrenergic states, as they're termed, cause anxiety. If you don't believe that, look up a pheochromocytoma. That's an adrenal gland tumor that secretes adrenaline, and frequently those patients are anxious out of nowhere. They have, you know, high blood pressure or high pulse, and they sweat a lot. Those can be some of the cardinal symptoms of pheochromocytoma. And it is all throughout the science that the high adrenaline causes anxiety in POTS patients too. So then it becomes a chicken or the egg argument. It also becomes a vicious cycle where now you're anxious, and the more anxious you are in the functional world, then more of a predisposition for breaking down your gastrointestinal tract, which all of your functional doctors are trying to treat with different diets and supplements. So you can watch my other videos on anxiety. Anxiety in and of itself is an entity. There are many, we'll say it this way, aberrancies of how the brain is wiring itself in anxiety patients. I talked about that a little bit a few months ago, and I'll talk about it more in the coming weeks. But that's kind of POTS. So I don't think I'm going to talk about POTS again for a little while unless somebody throws out a video or a video idea, a topic you want me to discuss, and then I'll go from there. And also, it's always really important if you have POTS, make sure if you're having new symptoms to get worked up by your doctor, because I can't tell you how often I talk to a POTS patient who thinks that they're having a POTS-related symptom. Maybe it's not a POTS-related symptom. And also, it's very important to see a doctor who's going to evaluate to see, okay, is it POTS, or do you maybe have something else going on with your heart? All these things have to be considered in the evaluation of POTS patients. So that's what I have to say. I thank you, all of you who are watching live this late at night. I'm wishing you a good night and good health. And if anybody wants to research articles from which I got this topic, let me know. And let me know what you think. Okay? Probably most of you will see this in the morning. Have a good morning, everyone.